Hello, I'm Joan Meyer. The Bridges to Health Home and Community-Based Waiver Program, also known as B2H, is designed to support children in their homes and communities. B2H serves children in foster care or Division of Juvenile Justice and Opportunities for Youth Community Services Supervision who have been diagnosed with serious emotional disturbance, developmental disabilities, and/or medical fragility. Once enrolled in B2H services, a child may continue to receive services even after discharge from foster care through age 21, as long as they are otherwise eligible. In this video, we'll be exploring the details of the Bridges to Health program. The video features an introduction and 6 chapters. This is Chapter 4, What are the services and how are they implemented? Part 6, Adaptive and Assistive Equipment and Accessibility Modifications. The purpose of this chapter is to help you better understand the B2H program services offered so that you can better inform parents and caregivers and help them understand the benefits of the B2H program. You'll also be able to help parents and caregivers recognize how their support is important in the provision of necessary services. Here to help us understand more about B2H and how it works is Isha Hines. Ms. Hines is currently employed at a healthcare integration agency. She has more than 10 years' experience in the child welfare field, working in group homes and as a foster care case planner. Isha, thanks so much for joining us. In addition to the ongoing direct care-related services we've discussed previously, B2H also provides for the physical needs of children by obtaining adaptive and assistive equipment. Isha, what types of equipment fall under this category?
Under adaptive and assistive equipment, it includes controls, aids, appliances, or supplies intended to supplement New York's approved Medicaid state plan medical equipment and supplies coverage. They enable the waiver participant to increase his or her abilities to function in a home and community-based setting with independence and safety.
And what are some examples of adaptive and assistive equipment?
One example would be a youth who's a quadriplegic, who's confined to a wheelchair, but can communicate via the computer. Though Medicaid would pay for a new wheelchair if need be, the child needed assistive equipment, which includes a head-mounted pointer and a mouse touchpad. And by having these equipments, it helped him to communicate more effectively with the individuals in his household and community. Another example would be a youth who needed an adaptive stroller. And the stroller allowed him to be properly transported within his home and community, especially to school. The stroller provided youth with supports that he needed to maintain proper posture.
Now, B2H can also help families by providing accessibility modifications. Isha, how would you describe accessibility modifications?
Accessibility modifications are internal and external physical adaptations to the child's home that are necessary to support his or her health and welfare. These modifications are additive services available through Medicaid state plan or Title IV-E funds and enable the participant to function with greater independence related to the child's disability and/or healthcare issues.
And can you give us some examples?
Sure. Some examples of accessibility modification include allergen controls, installation of ramps and grab bars, the widening of doorways and hallways, modification to bathroom facilities, or the installation of specialized electrical or plumbing system to accommodate necessary medical equipment or modifications necessary to support the participant's health and welfare.
Isha, thanks so much for being with us today. And that brings us to the end of Chapter 4, What are the services and how are they implemented? Part 6, Adaptive and Assistive Equipment and Accessibility Modifications. In Chapter 5, we'll review the referral process.